I was using the wrong type of toothbrush my entire life, and I didn't learn how to properly floss my teeth until I was in dental hygiene school. Why don't they teach these things to kids in school? Hi, my name is Whitney, and I'm a dental hygienist here to talk about what you should have learned about your dental health in school. And before we get started, make sure to get my free oral care guide. Click the link in the description below or in the pinned comment to join thousands of people who have already discovered all of the essential components for an effective oral hygiene routine. This guide is an action plan for preventing and maintaining a happier and healthier smile. I made it just for you, for it can also help you stay on routine and never miss a night of flossing. And having said that, for today's video, let's talk about what you never learned about your dental health. Starting with number 1, brushing. Your parents may have taught you quickly as a child how to brush your teeth, but maybe they were more like yelling at you a little bit about it being a chore. Like, brush your teeth! Did you brush your teeth yet? So something lots of people don't know about brushing is that you should always use a soft toothbrush. A medium or a firm toothbrush does not do a better job. It just gives you gum recession. Same thing about technique. You don't ever want to scrub brush back and forth. You want to make sure you're gently guiding the toothbrush from tooth to tooth, angling your toothbrush toward the gums for 2 minutes, twice each day. And electric toothbrushes. I've seen so many patients who use them wrong. They are using them like manual toothbrushes. But no, if you use an electric toothbrush, you have to just let it do the work for you. Angle it and guide it along from tooth to tooth. I'll of course link my tutorial videos if you want to learn more. Number 2, flossing. Did you know that you're not supposed to just pop it in and out? And you're absolutely not supposed to seesaw it. That's the insertion motion, but the cleaning motion is up and down. So sawing it between your teeth is only getting the string in between your teeth where it needs to go. And then once it's there, then you're supposed to use the cleaning motion. This is where you hug the tooth and go up and down to the left and then up and down to the right, making sure you're really wrapping around each side of each tooth, cleaning the sides of all of the teeth. Number 3, brushing your tongue, or even better, using a tongue scraper. 90% of bad breath bacteria sit on your tongue. So not only is it important to brush your teeth every day, but it is also very important to brush your tongue. And the best way to do that is by using a tongue scraper. Brushing it with a toothbrush is fine, but a tongue scraper is even better because there are so many little crevices on your tongue that bacteria can get caught in. And if you don't have a tongue scraper, no worries. You can actually use a spoon from your kitchen. It actually works pretty well. But if you want an actual tongue scraper, I will link some product suggestions in the description box below. Also, if you tend to get tonsil stones, make extra sure that you are using a tongue scraper, for it can really help prevent those from forming by reducing the bacterial count in your mouth. Number 4, mouthwash is not needed unless it's recommended by your dental provider. Sometimes for extra cavity prevention and sometimes for sensitivity relief, or if you just had gum surgery or struggling with gingivitis, there's different ones to use for different things. But just to use it without a rhyme or reason is not important. What's important is brushing and flossing and or cleaning between your teeth properly with proper technique. Which brings me to number 5. You don't have to floss. If you don't like flossing or you have a hard time using traditional string floss, it's totally okay to use floss picks, interdental brushes, or even a water flosser to clean between your teeth. Just make sure you're using proper technique. I will of course link all of my demonstration videos in the description box below if you want to learn more. And number 6, the importance of prevention. If you think getting cleanings and checkups every 6 months at the dentist is expensive, that's nothing in comparison to what you'll pay later if you don't. And it's not just the large amount of money you'll be needing to pay for deep cleanings, fillings, crowns, root canals, but also the pain that comes with it. And I'm not saying those procedures cause pain. No. When you need dental work, they will numb you up prior so you won't feel anything during the procedure. The pain I'm talking about is what you're feeling before you come in to fix it. I'm saying you will have tooth pain that causes you to need to get one of those procedures. And these surprise toothaches oftentimes come from the lack of preventative care, the lack of visiting your dental office for routine checkups and cleanings, as well as not brushing and flossing daily at home. And take it from me, someone who sees this happen every day at work. Ask anyone that you know that has had major dental work done and see what advice they give you. A lot of times I will have patients tell me if they could go back in time, they would have changed the way they cared for their teeth at home when they were younger. Lack of knowledge really can hurt people, which is why I made this video, because I wish more people knew how brushing twice each day, flossing and or cleaning between your teeth at least once each day, and visiting your dental office for checkups and cleanings every 6 months can really prevent and maintain your dental health, saving you money and time in the long run. And if you don't have dental insurance, I will link my how to get affordable dental care video in the description box below. In all, I like to tell my patients to try and turn something that seems like a chore, like brushing and flossing, into self-care, right? Taking care of your teeth is an everyday essential that unfortunately isn't properly taught in school. None of us learned it in school. But building a dental health routine is doable. And doing it right with the correct technique can help you avoid devastating dental costs. And speaking of routine, if you are interested in creating the perfect oral care routine, be sure to click the link in the description or in the pinned comment below to sign up for my free oral care guide and join thousands of people who have already discovered all of the essentials for an effective oral hygiene routine. And I hope this video helped you. Please like, subscribe, and turn on your notifications if it did. And if you want even more teeth talk, you can visit my website teethtalkgirl.com and hang out with me on Instagram at teethtalkgirl. Peace, love, and teeth.